Good morning, good afternoon, good evening, everybody. I would like to warmly welcome all of you who joined us on today's webinar. I hope that you and your loved ones are all keeping healthy and safe during these challenging times. My name is Najat Rashdi. I'm the director of the Peer-to-Peer, and I am delighted to be hosting this Peer-to-Peer webinar on prevention protection measures in populated areas during the COVID-19. Before moving to the substance, I just would like to say a few words about how the webinar will work. It will last 90 minutes. It is divided into 5 parts. Part 1, I will put forward questions to the first panel. Part 2, we will take questions from you, from the audience. Part 3, I will put forward questions to the panelists. Part 4, I will take a final round of questions from you. And part 5, Rena, Jelani, the chair of the Emergency Director Group, will close the webinar. Some technical guidance to keep in mind throughout the webinar, please. You should stay on mute through the course of this webinar. And please have your camera turned off at all times during the webinar. Resident coordinator and humanitarian coordinators can unmute and ask questions on the floor. They need either to raise their hand or to send their questions if they cannot do it through the chat room. And please, for whoever else, use the chat box on the right-hand side of your Webex window to communicate with everyone on this webinar. Well, as we all know, COVID-19 is challenging some of the foundations of the humanitarian community and humanitarian sector as we knew it before. The way humanitarian actors are approaching the current new reality with the COVID-19 is shaping actually the humanitarian aid delivery. Humanitarians now have to practice physical distancing when distributing aid, when raising awareness, when engaging with communities, with the aim to minimize exposure of the affected people and aid workers in camps, in slums, and in populated areas. I would like really to thank all the speakers and the panelists who actually are joining us, and they will take us through what has been put in place to comply with the COVID-19 measures in populated areas. And it's my pleasure to introduce the panelists with big thanks to Jeffrey Labovitz, the Director of Department of Operations and Emergencies in IOM, Xavier Creech, Head of Protection Services in the Regional Bureau for West and Central Africa, UNHCR, Felipe de Corte, Chief Program Development Branch in UN Habitat, André Krumacher, Vice CEO Programs, Impact and Accountability in ACTED, Teresa Zakaria, Health Emergency Officer in WHO, and Juan Sofon Panic, Global CCI Coordinator in IOM. So without further ado, let me ask Jeff and Xavier to address the specific steps that have been taken by your agency cluster to protect the populations in low-resource settings, including those living in camps and sites and camp-like settings, as well as prevent and mitigate risks for them and the surrounding population from the spread of COVID-19. Jeff, over to you.
Thank you, Najat. Can you confirm that you can hear me well?
Yes, we do.
Very good. It's a great pleasure to be speaking here, and it's wonderful to participate in this peer-to-peer, particularly because it includes, my understanding is HCs and HCTs, as well as colleagues from the NGOs and also UN agencies. And it's a wonderful opportunity for us to come together, and I very much look forward to the questions and answer session and to hear what the HCs and different colleagues are feeling in the field. I also wanted to congratulate for all of those involved in drafting the IASC Interim Guidance for Low Capacity and Humanitarian Settings for COVID-19. I think it's one of the best inclusive and important documents which is currently out there. I'm going to talk a little bit about general preparations. I'm going to ask for a little bit of help from my colleague Juan on specific issues. But let's start and see what we've done to look at overall operation side to ensure that we can continue to support and assist displaced populations, migrants, and those in humanitarian settings. One of the first things we did was to start to collect and compile information on various measures and restrictions imposed by different countries to suppress transmissions. This was all about access and understanding how we can access our beneficiaries. This has included information related to restrictions on IDPs, point of entry status, public health and border management measures in place at airports and border crossings, and new border management procedures. This is part of our displacement tracking matrix, our data mechanism. With NGO and UN partners, we are actively working to support national and local authorities with the joint message that displaced populations, including migrants, are explicitly included in national preparedness and response plans. As with all agencies, movement restrictions have also impacted our own staffing and how we search. While we're not able to send a whole bunch of people out right now, we need to ensure that frontline workers are able to rotate, and with WFP's led new transportation system, we're jointly advocating that this is operational as it did start in the beginning of May. WFP is also established within the coordinated system, of course, the supply chain methodologies, and they're working jointly with WHO and PPE and other medical supplies in identifying where they need to be. It takes time, we understand that, but jointly the system has identified that this needed to happen. In addition, in looking at camp management and implementation and operational issues, we have streamlined procurement processes. We've promoted caste-based initiatives. We've revised in IOM, UNHCR, others, how we work with NGOs, and we're trying to get more flexibility. This is in line with our international commitments and the Global Compact. And like all agencies, we're working hard on duty of care, including medevac and services for implementing partners. IOM itself is going to support UN medical facilities with laboratories, doctors, nurses, and clinics where we can. Now, in our role as the global co-lead of the CCCM cluster, we have been acutely concerned of our responsibilities and engaging partners and giving guidance on how to best minimize transmissions in low capacity and humanitarian settings. This was clearly going to be a challenge in how we apply it to camps and formal settings, transit centers, and urban slums early on in this whole pandemic. By mid-March, the cluster had issued an operational guidance for its camp managers and partners. Now, to conserve time, I'm going to pass over to Juan very quickly here so she can give some specific examples. Over.
Thank you, Jeff. I trust that everyone can hear me well. I would like to maybe share some kind of concrete examples of what we've been doing in 2 or 3 countries of operations. One of the core responsibilities for camp management agencies is around community engagement, participation, as well as representation. So right at the start, this is one of the most of the key concern for us. And I think to ensure that the displaced population are able to access factual and relevant information, and also to track and capture and also counteract any rumors that were spreading amongst different population groups. So one of the things we started doing is doing awareness sessions, establishing alternative communication channels. I think keeping in mind all of our operations is looking at possibilities of us having to transition into remote management for all the camps, and that monitoring of services and the different tools that are being used in the camps by humanitarian actors at the moment are going to have to be adapted for the self-managed and community-led monitoring processes. One of the key things of concern, obviously, is around referral mechanisms. as access to camps and sites become more limited, what is considered non-essential services are being reduced. And this also means it also impacts the referral mechanism that were in place ahead of the pandemic. Next slide, please. The example picture just now is from Somalia. Some of the key things that we've done is also, as I mentioned, around consultation with the communities. I think many of you would have been aware around discussion around different measures that can be put into camps. A lot of us were thinking whether how this can be possibly applied in areas of high density, low access to clean water, health facilities. And one of the key things we were able to provide for the humanitarian communities also is discussing with displaced population, community leaders, religious leaders, around what would be the best adaptation for different areas and places we're working in. Obviously, somewhere like Cox's Bazar, we're working also with partners to adapt the distribution, whether in kind or cash-based, in order to maximize the distancing and reduce mass gathering within the camps. We look at site improvement, that adding hand washing stations at communal facilities. We work with health and WASH colleagues and other actors to improve and upgrade existing facilities, as well as sometimes expansion or construction of facilities for whether in addition to the existing health facilities or for isolation or quarantines within the site. Next slide, please. Just the last slide from my side. One of the things that we've also been working with local authorities around is to work on contingency and containment plans for sites. I think if I can leave two messages, one around community engagement and participation, the other would be around adaptation. I think we are very much aware that the different plans need to be adapted to the context that it's going to be applied. So for Nigeria, there's been various suspected cases. So we've been putting into practice also these contingency plans when a suspected cases has been identified, for referral, for testing, but also for new arrivals coming into camp. Working with Ministry of Health, health sector lead, as well as health actors in the site. We've been working on what they decide to call self-quarantine shelters for those arriving into the camps, as well as looking at management and maintenance of these facilities. One of our concerns is that a lot of these facilities will be set up and there'll be no one to manage them, and that camp management actors will end up as a provider of last resort, taking on more responsibilities, but also more risk for something that they might not be trained for. A big concern in a lot of places we're working in is the fact that a lot of preparedness activities are being put on hold and considered non-essential. So preparation work for upcoming cyclone or ongoing rainy season are being put on the back burner, and this will likely also affect how the communities can recover following the pandemic. So that's all of my point. Thank you very much.
Thank you very much, Jeff and Juan. Xavier, over to you.
Thank you. Good afternoon, everybody. Thanks, Najat, and I would like to join Jeff and IOM to congratulate IASC for the guidance, the quality of the guidance provided, but also the timely. It came very early on, and that was very much appreciated. My slides are not that developed because I joined a bit at the last minute, but I think that a protection note on the impact of COVID on protection issues has been shared with all the participants with some good practices, concrete examples. I will try to be brief. Sorry if I'm sometimes telegraphic. First, COVID increase considerably the risk of marginalization of displaced population, refugees, IDPs, stateless people, host communities, and returnees. Marginalization, governments are struggling to have a response in place for their own citizens. Displaced population are barely ever the priority. Second, risk of stigmatization. Refugees, IDPs are by definition moving from one city to the other, from one country to the other. There is a real risk that they are perceived as contributing to spreading the disease. In this context, it contributes to exacerbate all the previously already existing protection risks. Sexual and gender-based violence didn't start with COVID, but COVID exacerbates. Refoulement didn't start with COVID, but closure of border exacerbates the risk of refoulement. Trafficking, smuggling, etc. So this is just a very quick panorama on protection risk. Forced recruitment also, I forgot to mention that. So what is important, I would like to insist on 3 elements. Inclusion. Jeff and IOM mentioned it, but inclusion of refugees, IDPs, what we call person of concern, are essential, but not only a legal inclusion. Most governments, at least in the region I work in West and Central Africa, are including refugees and IDPs. So in theory and in practice, and it's where we have a very important role to play to support government in making this inclusion a reality. I could detail all the WASH, health, shelter project that has been done, but I would also like to insist on supporting government in putting appropriated health control measures in place in border entry and exit station. Closing border, for example, result in all voluntary repatriation operations to be suspended. Result, we see spontaneous and uncontrolled returns without appropriate measure in place. So inclusion, but not only a theoretic inclusion, also in practice supporting government. Second, we must put people at the center of the response. And this, I would say, at the center with an age and gender and diversity approach. What does that mean? It means communication with community. There is a need of active two-way communications with all the people, but also all community, and adapted to age, gender, and diversity. The risks are not the same for everybody. Elderly, women are considerably exposed. They are exposed because they are often taking care of elderly in their communities, they are often taking care of the house, they are often taking care of the children. Increased pressure on them, domestic violence in the increase. So communication with community. Here, I would like to mention a very good initiative which has been developed in the context of the interagency working group in Dakar, and together with IOM, we have developed this Corona West Africa.info website. I don't know if they can be shown at the same time. It gathers all community engagement tools available in many different languages, so you can all use it. Now I think it's more than 32 NGOs, UN agencies, and others participating to this website. Oh, great, it's now here. You can see you can download video, audio, posters who have been checked by WHO and which are available in many different languages. So communication with community, this includes feedback mechanism. It's very important. You know, in this situation, we always believe we know what people go through. It's not always the case. Us, through this feedback mechanism, we are really discovering some issues we are not necessarily suspecting linked to COVID. And it's very important that the communication is not only giving messages, but also being ready to receive them. So communication with humanitarian principle. You know, when we always talk about do not harm, in the context of COVID, it's particularly important. We have talked about refugee camps, but in West and Central Africa, most of the displaced population are not in refugee camps. They are in urban setting, poor neighbor setting, so very often overcrowded. And in this context, we have to be very careful that we don't bring COVID. So it's not only that we must have the response in place, but we must be careful that us, protection actors, humanitarian actors, is not a factor of transmission ourselves. And last, because I think I don't have the time, but I would have, you also see a dashboard that we have put in place. We're updating every 2 weeks on the measures. So it's flagging a bit when border on closed, access to asylum, access to education. I would say the importance of working closely with development actors. It is always important, but you know, we often talk about bridging the gap between humanitarian and development actors. Here we are talking about working from the onset of the emergency together with development actors. The example of education, for example, is very important. Supporting government in putting in place a distant education learning program. This helps us to allow the inclusion of all. So I've tried to be very brief, but I hope to have the opportunity to discuss more at the end during the question and answers. Over to you.
Thank you very much, Xavier. You have done very well, time-wise. We have shared with all the participants in the chat box, you know, the documents and the links Xavier and Jeff were referring to. So don't hesitate to consult them. I turn now to André, which will conclude the first set of presentation, but with more focus on INGOs and national NGOs. So André, please tell us more about the challenges which are COVID-19 pandemic specific faced by INGOs and national NGO staff, and are there any specific modalities to deal with aid workers actually who have contracted the virus? Over to you, André.
Thank you, Najat. Good afternoon, everyone. I hope you can hear me well. It's a pleasure to be on this panel and outline the NGO perspective. I don't have a specific presentation, so I will talk a little bit about the challenges. Indeed, COVID-19 has aggravated previously deteriorating humanitarian conditions and increasingly complex operational environment for frontline responders from NGOs, be it international or national, and prompting new operational challenges to emerge. Let me highlight the 4 main challenges. There are more, but I just, in the sense of time, I focus on 4 that are really crucial from our perspective. Some of them will not be new, but I just would like to highlight on how they are concretely affecting NGOs, and in particular in context of in urban contexts or in camp settings where we have a lot of high level of high population density. So first of all are restrictions on international and in-country movement of humanitarian personnel and goods, as well as...
Sorry to interrupt you. We don't hear you very well. Can you get closer to the mic, please?
Sure, no problem. Is it better?
Yes, it is. Thank you.
Okay. So the first constraint or the first challenge are restrictions on international and in-country movement of humanitarian personnel and goods, as well as administrative and bureaucratic obstacles that hamper the response. So as you know, the pandemic is profoundly affecting international supply of products, medical, but not only, through disrupted air freight and maritime transport, as well as restrictions on the export of equipment and medicine. Closure of borders also means that other emergency activities face severe delays due to lack of personnel and lack of supplies, including, and it's not only health, but also critical wash, food security, and shelter intervention. In some countries, government bureaucracy has prevented newly hired NGO staff from receiving visas, or long-term expatriate aid workers from renewing their visas, impacting their ability to reach affected communities as well as to provide technical support programs. So, for example, in ACTID, our international staff numbers are currently down by almost 30% in the countries in which we work. In addition, authorities in many countries have taken actions that restrict movement also domestically, impacting the ability of NGOs to move personnel and goods. So, for example, in Bangladesh, As an NGO, we are not allowed to cross district boundaries, while such restrictions do not apply to UN vehicles and UN staff. And the camps in Cox's Bazar are in different districts, so we cannot, in the case of Active, for example, effectively carry out certain camp management activities. In DRC, which is a vast country and where the humanitarian community really relies on air services, they have been severely reduced. And yeah, this is really a challenge. Of course, we welcome the recent setup of the Common Services Hub by WFP and other UN agencies in Addis and Accra, and I hope this will help us to overcome some of these challenges. It's also more difficult for NGOs as compared to many UN agencies to have access to government and get information and updates directly, or even critical supplies. We also face more and more challenges for receiving approvals for new emergency projects as compared to many UN agencies. And also in some areas, government telecom restrictions impact the ability of our staff to communicate with people in need of assistance. So community mobilization and communication with communities becomes really central in the response of NGOs, as has been already explained by colleagues from IOM and UNHCR. So, for example, for Active in camps in Somalia, Niger, and Bangladesh, we have conducted extensive capacity building for volunteers to ensure CCCM activities can be completed with limited staff presence. Or in Northeast Syria, we have facilitated infection prevention and control training for volunteer workers of all organizations active in the camp, so they continue providing essential services while other NGO staff may not be able to access the camp. The second constraint is linked to funding. Obviously, budgetary pressure from donors that usually contribute to the international humanitarian response is a problem, and we have seen a lot of diversion of funds from existing humanitarian programs, and repurposing resources from already underfunded humanitarian operations to respond to the COVID-19 virus could then result in even more acute shortfalls in addressing current humanitarian needs. Frontline responders from NGOs, we do require additional funding, not reallocated funds or funds borrowed from other critical ongoing work to ensure the response to COVID-19. It's also important to note that while key economic actors have, such as IMF, World Bank, the G7, has mobilized billions to provide budget support, we also need to ensure an effective link between the global pipeline and the local pipeline with scalable outputs and that's very important, at the citizen level, in order to decrease what I will call tensions that might exist between the global announcements, the government priorities, and citizens' expectations. Overall, we need a more holistic and systematic and better anticipated approach between what at this stage is often perceived as a global health crisis, but which is clearly also an economic crisis. A third point is safety and security of frontline humanitarian workers, and this is very important. We have seen an increasingly hostile attitude towards foreigners, all those associated with foreign organizations, including international humanitarian NGOs and their staff. Rumors have already been surfacing in multiple countries, such as Nigeria, Central African Republic, Bangladesh, DRC, that foreigners, be they humanitarian personnel or refugees, are behind the spread of COVID-19, which necessitates us a clear communication and community engagement. As such, we try to debunk rumors and myths, and I think one has already spoken about it. In the meantime, we do expect that the most delicate phase might be the progressive deconfinement once it comes, because Number one, countries will be tense in terms of food security for their own population. Criminal groups might try to recover some loss of business, let's say, that they had during the confinement period. And we will still have, of course, clusters of coronavirus, notably in crowded urban areas and camps. So there is this tension between three different developments: the need to restart the economy, the economic consequences of COVID leading to potentially to social unrest, and the increase of illegal activities given the context. Now, how is this relevant for NGOs? As NGOs, basically, we need to increase our footprint with the populations we serve, especially amongst the most vulnerable ones, and accompany the deconfinement, which will most probably take place in the countries in the next month. And not only is this a duty for us, but it's also a security and safety issue, complementing government measures to be able to reach the hard-to-reach areas traditionally underserved and or overcrowded. Now, I know my time is running out. Let me say, I will skip my fourth point, but let me quickly say something related to specific modalities for aid workers who have contracted the virus. Of course, the importance of the principle of saving lives together implies duty of care for all humanitarian and development workers, including expatriate and international staff of NGOs. So modalities to deal with aid workers who have contracted the virus are, I would say, not necessarily very different than any other modalities. Of course, we do adhere to WHO and country-specific protocols and guidelines. This includes self-isolation of staff who have been in touch with individuals who have contracted the virus and or show symptoms or are suspected to have contracted the virus. And we also do contact tracing. We have put in place evacuation plans for expatriate staff regardless of nationality. We identified designated healthcare providers for both international and national humanitarian staff, particularly as local facilities may become overcrowded. And we welcome specifically the setup of the hospitals in Addis and Accra by the UN for humanitarian workers, and hope they will be opened up to NGO workers, both national and international, and we hope visas can be facilitated in the worst case that we have to fly such workers to these hospitals. Thank you very much.
Thank you very much. Thank you very much, Jeff, Xavier, Juan, and Andre. Now I will take questions from the participants. I don't see any in the chat box. Please, if you have a question, either you post it in the chat box or you raise your hand so we can unmute you. Any questions? Okay.
Yes.
Yes, Messi, go ahead, please.
Sorry, can you hear me?
Yes, we do hear you, Messi.
Yeah, first of all, I really want to thank the organizers and the presenters for such succinct and very relevant information with the lessons. 2 points that I just want to bring forward, knowing that the risk level is becoming high, as in some countries, transmission is at a community level, and Burkina Faso in Africa is among the 15 countries with community transmission. The second one is that the restrictive measures have been lifted, and progressively people are moving into their normal lives. So the risk is even higher. Movement, of course, is not restricted anymore. The specific question is, given we need to focus in this particular context more on prevention, have we as a community, in addition to the lessons that you have shared, thought about how we would organize for the countries where masks are becoming an obligation as a community, as part of the prevention and preparedness package? Have we thought about how that would be organized? We want to avoid a situation that you have spoken about, the risk that it will be coming from outside, given the relaxation of the measures. That is the first question. The second is related still to the lessons that are emerging, which I'm sure would apply to a number of countries. The confluence between accountability to affected populations as well as the messaging around the risk of exposure given the COVID. Is there an initiative like there is around the messaging libraries, message library around community engagement, so that we can have that as just a baseline for everybody? The things to say, not to scare, but for people to understand the level of risk. Over.
Thank you very much, Mitzi. Just before giving the floor to the panelists, I just would like to mention that the next webinar, which is next Wednesday, will address the community engagement and the AAP. So a lot of, what is related to your question too, will be very much developed in the next webinar. André, you want to address the question, the first question?
Yes, sure. In fact, this was originally a point of mine, but then in the sense of time, I left it out. I think this is very, very important. We need to anticipate now and in a better way this whole question of the deconfinement. And I think it is very important to bring both health and economic priorities of the deconfinement together and create a win-win situation here, especially when it comes to preparedness, when it comes to prevention and the use of masks and other personal protective equipment. I think we really need to look into initiatives that create local jobs, focusing on the production of such personal protective equipment, such as masks, but also soap, sanitizers, etc., that first of all, that gives the opportunity to employ a lot of people and that contribute to also to health, to improved health outcomes during the deconfinement. So, and as an example, in Afghanistan, we are currently working with the Ministry of Health and with several thousands of people in Kabul and Mazar-e-Sharif to produce 1 million masks per week. And I think this is quite an interesting initiative that's worthwhile to look into and scale also in other countries. I know there is various discussions and controversy around masks, but given there are not enough masks globally available, given there are so many issues around importation of such masks, better to have some masks that reduce the droplet spread than having no masks. And I think we need to look into local production to also give people who have been affected by the economic crisis due to the confinement during the deconfinement phase. Over.
Thank you, André. Jeffrey, Xavier, anything you want to add?
Jeff? Otherwise, I could answer on the question on messaging.
Go ahead, Xavier. I can go afterwards.
Thanks. Okay. As I said, together with IOM in Dakar, but now it's more than 32 agencies, Betsy, we have done this library, which is called coronawestafrica.info. It particularly targets Burkina Faso, where you are based. So you would find there not only messages, but very different technology available, video, radio spots, podcasts. And in addition, this is translated into many different languages of the region, beyond French and English. So it was put, and now it's 39 organizations contributing to this website that a colleague of IOM and UNHCR have jointly developed. So I think it's the best thing. And again, if some other participants have tools, I mean, please send them to us. We'll be very happy to upload them. For you to know, Betsy, all these messages we post on this website are checked by WHO first before putting online to ensure that health-wise they are good. I would like to insist on what I've just been said before me on the importance of livelihood, and especially how to adapt also support to livelihood to the context. No, I think CBI is particularly relevant. It has to be well targeted because we have to make sure that it also addresses some of the issues of the beneficiaries that the local market allows for them to use. But it's also very important that our livelihood effort be customized to the current context and the implications that the confinement measures have on the economy. Last point on the messages, we could also send you more, no? Because this coronavirus West Africa, coronawestafrica.info is really done for West and Central Africa, but on WHO, on UNHCR, but I'm sure on IOM and on many other websites you would find them. Don't hesitate to ask us directly if you can't find what you need. Now, what I would like to insist again is CWC. It's not only us speaking to the refugees or the displaced. It's also very important that we listen to them because they are in an unprecedented situation or exposed to more protection risks than before. And we must really maintain this quality of listening to be able to have a well-adapted response. Over to you.
Thank you, Xavier. Teresa from WHO is our next speaker after we finish with this set of questions. So I am sure she will address more the use of masks in the community. Jeff?
Thank you, Najat. Let's make sure my microphone's in front of my mouth. Metzi, my best greetings to you, Metzi. It's wonderful to hear your voice. I'm so sad we can't meet in person anytime soon. I've been looking at Burkina, and I've been seeing that was one of the first countries to show growth in COVID numbers. I wasn't aware that you've already, you no longer have a lockdown. You've started to open up. I wonder what that means. It feels like Africa is not yet seeing what is coming in terms of the intensity, and it's at the start of and not yet flattened the curve. So I'm interested to hear more about why they have done that and what you think about it. But I think that what you're talking about the most is, you know, how do we responsibly open up? And, you know, this isn't, you know, just to have concerts and have mass amount of people come together, but how do we responsibly do social distancing and do messaging accordingly when in camp settings and urban settings in a responsible way? I wanted to give Juan the floor. So Juan, here's a quick heads up on that. I'll talk for about 2 more minutes about it. But Juan, the London School of Tropical Medicine had come with some advice on how we would separate elderly and separate at-risk groups completely in camp settings. I think the IASC looked and read that and didn't feel it was possible because it entailed so much construction and extra work. But maybe you can talk about what that means when we're opening up, because there's certainly the most vulnerable populations within vulnerable populations. And so, Juan, over to you on that. In terms of just travel, I mean, I talked about it in my opening, and we're certainly looking at this with IATA and other organizations, because we have to see how we can get from A to B responsibly and what changes that's going to entail. I know that our development side of the house, working at airports and ports of entry, is looking at what are the medical criteria and how we can encourage trade and encourage travel, because it's related. Trade comes with people. And that's something which I think it remains to be seen how it's exactly going to look like, but it's something we have to be prepared to. Juan, if I can just pass over to you on this issue of the tropical medicine, which we had talked about briefly. I hope you're on the same track as me. Over.
Thank you, Jeff. Sorry, I was just gearing up to talk about our mass production project in Bangladesh, but we can certainly talk very briefly about various different ideas on how to best protect and prevent people. I think I mentioned briefly on, you know, like how to minimize mass gathering, maybe put in schedule on communal spaces, what the London School of Hygiene and Tropical Medicines were putting forward. is around creating a safe area or a green zones at various levels. So this can be done within a household, which I think it's very common advice, even in Switzerland, are being, provided to different families. That you have a room, you can put someone who are more vulnerable, and therefore limit their contacts with the other people in the household or in the communities. Or you can set up some shelters that are specific for high-risk people, or larger buildings at a community scale. Obviously, I think we've discussed this also with WHO and with Teresa, and I think while it's interesting to explore different options and ideas in such challenging conditions, from what we've seen, I think, and the consultations with the communities, it's going to be very, very resource heavy. First of all, for us to convince the communities to go into facilities while they're not sick. Second, with limited resources, we follow the WHO guidelines around prioritizing, early identification, isolation, and quarantine. So with limited space and resources, we would think that this is where we would prioritize our efforts and capacities. I understand that in some camps there are various kind of pilots and testing going on, but I think most of the ones that are going ahead are the ones at the household level that are being tested. I also just want to mention, and maybe Teresa can say more also about the risk communication and community engagement group, which I think WHO, UNICEF, and IFRC are part of, and who are also about to set up collective service, primarily, Metzi, what you were mentioning around ensuring that everyone has the same consistent messages that are going out to the different people. Yeah. Sorry, I can go on, but I will stop now.
The question comment from Johannes before moving to the second question and the presentation from WHO and UN Habitat. Johannes?
Najat, and greetings to everybody. Very familiar voices and visitors to face. A few points from my experience in economic development moreover. So what we face here, like Metzi in Burkina, large IDP population, only a very limited number of social sites where congestion and
we don't hear you very well. Maybe if you turn off the video, that will be a better quality. I don't know. We don't hear you very well.
I don't think I have the video on. Do you hear me better now?
Yes, yes.
Yeah. No, I just wanted to fact that Mali here, we have a large IDP population, and only a minority is hosted in sites through the congestion and the congestion and the preventive awareness measures, but 90% or more lives as host families in urban settings, but also in rural settings. And we have set up a kind of system training community leaders and others, community health workers, of course, to reach out to all these IDPs. This is the host families, but this is a real challenge given the numbers, given the distances. So that is a reality we face, and where they live in a society here where these physical distance measures hardly work because people are too poor, they live all in cramped conditions, they have to go out to their daily job and resources together. So that is one big. Second, as Jeff, I think, said, how we can keep the referral mechanisms up and running. It's a real challenge. And manage in certain areas, for instance, our SGB services are still working because they're somehow linked to other services. Yes, it's something we need to continue to invest in, but it's a real challenge. again, notwithstanding the increasing humanitarian needs and the life-saving nature and direct assistance nature of our work, we still try to work also on livelihood opportunities by IDPs for host families and to have income-generating projects. It's a very, there's a lot of intervention also by the development agencies. Javier also mentioned in the Nexus, I mean, that is still something you can and you should practice even in this crisis. Thank you.
Thank you very much, Rena, for sharing with us your examples. Now I turn to Teresa from WHO for the second and last question. Teresa and Philippe from UNHCR. So the Interagency Standing Committee Interim Guidance we just shared with you in the chat box for COVID-19 public health and social measures in low capacity and humanitarian settings proposes multiple key actions derived from generally recommended measures. Can you tell us how are these recommendations being implemented, and are there tools in place to measure the impact of these recommendations, but also address the question from Macy regarding the mask? Over to you, Teresa.
Thank you very much, Najat. I hope you are hearing me okay.
We do, thank you.
Thank you. So thank you as well for the opportunity to be present in this P2P webinar. I'm grateful for the occasion of this interaction with all of you. So speaking of the new IASC guidance, please allow me to first of all thank all the colleagues from ICRC, IFRC, IOM, NRC, Social Science for Humanitarian Actions, UN Habitat, UNICEF, UNHCR, and WHO who have contributed to the development of this guidance, as well as the many other colleagues who took time to review and enrich the documents. Please, if you could go to the next slide. So as you have mentioned, the key actions proposed in the guidance are indeed derived from the public health and social measures we're all familiar with. When we started to write this guidance, we all agreed that it is critical to keep the public health principles behind these standard measures if we want to effectively prevent and control the COVID-19 outbreak, while contextualizing the actions to be prioritized based on the characteristics of low capacity and humanitarian settings that are described here. So we're talking about settings with overcrowding and inadequate shelter, with lack of wash, a lot of dependence on informal economy and daily wages, different demographics and risk factors, though, for disease outcomes, which are still very much unknown to us for these type of settings. But we also acknowledge that there are local structures and systems that are functioning well in these settings. From the health system point of view, we also know that in these type of settings, it is very likely that there is already poor delivery of essential services, poor financial protection for healthcare, the weak capacity for detection, testing, and tracing. The health facility is not fit to treat cases with insufficiently trained workforce and lack of supplies. The public health and social measures such as physical distancing, home confinement, movement restrictions, hand washing with water and soap, and wearing masks are all recommendations that are based on the modes of transmission of the SARS coronavirus 2, which is why they are effective. But we have learned that these same principles can still be applied even when using a combination of different actions, and that is what we try to highlight in the guidance. So the key actions proposed in the document are an interpretation of the same principles, but aimed for the target settings, low capacity and humanitarian. They were developed based on consultations with humanitarian partners at the operational level, so we had lots of discussions with country operations, as well as the expertise and experience from the drafting team. Actions to promote distancing in overcrowded settlements, such as the scheduling of movement and assistance, the placement of additional physical barriers, like the ones that Juan showed in her presentation, the establishment of unidirectional flows to balance the lack of space, and placing simple hand-washing stations at multiple locations within settlements and in households were proposed by colleagues who were implementing these already. And to address the limited capacities of testing and treating those who have COVID-19, tracing and quarantining their contacts, actions such as systematic screening at strategic locations within settlements, the use of syndromic surveillance, and the designation or construction of community isolation and treatment facilities were emphasized on. So we fully appreciate that these actions remain challenging in many settings, but we also believe that with strong community leadership, collective agreement, and further localized adaptations of these actions, combined with all sectors scaling up, it is possible to implement them. Many of these actions also represent important investments for longer-term development, which we all aim for. Next slide, please. So what we would like to do now is capture more feedback and operational experience on how these key actions are implemented or not implemented, the feasibility, the additional adaptations that are made locally in various settings. One, you raise an important issue on the human resources. Who will be managing these community isolation facilities and treat patients? This is definitely an area critical to monitor. Our thinking at the moment is that there could be task shifting, utilizing a lot of community members who may have basic knowledge to be engaged in the response. But it is true that we are yet to see how this is going to be implemented and what will be the challenges related to this. All this information, the feedback, and the experience will enable us to therefore enrich the document further, which would be reflected in the next versions. So the Global Health Cluster is setting up a COVID-19 task team that has the objective to do this exactly, among other things. So this could be the first platform for our next steps. And we very much welcome other suggestions on how to go about this next big task. Next slide, please. So please allow me to present one last slide. It gives a short description of all the public health and social measures and the respective key actions contained in the document. We felt that it is important to capture the entire scope of COVID-19 preparedness and response in this one document with the hope of helping our colleagues on the ground to navigate through the different themes and then link in the various and more specific technical guidance that already exists. So you will see that issues such as risk assessment specific to each setting, the usage of masks, the usage of personal protective equipment, how to go about isolation in quarantine facilities in these type of settings are addressed to an extent in this document. And this is why the structure of the recommendations and the key actions also follow the WHO Global Strategic Objectives to capture the entirety of preparedness and response to COVID-19. So if you'll allow me as well to address specifically on each use of mask, I think this is always a very interesting topic to discuss. It is true that mask is perhaps the most visible measure that one can see, and so it does provide that reassurance. But from a technical standpoint, we cannot have mask as a single intervention. Mask is unfortunately not the magic bullet. It will never work unless it is complementary to the other very important measures such as the distancing and the hand hygiene and respiratory etiquette. We have seen also how masks are being used wrongly, with, for example, the nose still being visible or individuals using masks keeping on touching their face while using the mask. So using mask is one thing. It may be beneficial if it is combined with other measures, but then how the mask is used, how they are being disposed or washed is equally important, because if these steps are not followed carefully, then mask can actually not only give a false sense of security, but also be an additional risk factor for the infection of the virus. So a couple of messages around mask and other measures are described in the guidance, and we hope that they may be useful to everyone, and we would very much welcome your thoughts on the key actions proposed and the recommendations moving forward. So thank you for your attention.
Thank you very much, Teresa. Before giving the floor to Felipe, I just wanted to remind you that the webinar is recorded and that we will be uploading the presentation, the PowerPoint presentation, in our website, and Venkatesh will send it now in the chat box. Felipe, please, last but not least, can you please tell us what are the key elements to prepare for and respond in urban settings, informal settlements, and slums by UN Habitat to deal with COVID-19 as a follow-up to Teresa's presentation. Over to you, Felipe.
Thank you. And can I have my first slide, please? Allow me to go back a little bit in time, because for UN Habitat, the learning really started with the Ebola outbreak in West Africa in 2014. Myself, I was stationed in Monrovia, seconded to UNMIR, explicitly to kind of look into the urban dimension of the Ebola outbreak. This is the kind of map that most of you are used to look at as discussing the response with national counterparts. You will see, of course, immediately the dark dot around Monrovia, and our main point was from the beginning was to really understand, one, the link between the dark dot and the rest of the country, and two, if the dark dot represents 50% of the cases, what does this similar map look like at the urban level? And specifically noting, back to the first point, that in the dark dots, more than half of the people were not born in Monrovia, but exactly had very strong linkages with other parts of the area. And have the second slide, please. And so we quickly kind of insisted on being able to produce more granular maps of the urban areas to discuss the status of the outbreak and measures going forward. And so we asked CDC and MSF at the time to help us produce this neighborhood level map. And one of the first recommendations we made was to be able to decentralize coordination around impact, to be able to tailor responses, national responses to urban settings, to take into account this complexity of an urban area and understanding what's happening at the granular neighborhood level. Just to point, for instance, to the dark blue spot here, turned out to be a slum community with people from Sierra Leone who were Muslims, completely distinct from the host community around them, had been there for generations, so not a recent influx. So it's still with a lot of back and forth. So we saw a direct link between outbreaks in Sierra Leone and then consequent, a week later, an outbreak in this specific neighborhood in Monrovia, which was connected also to a major transport and market hub in the city. So it very quickly became a hotspot in the area. So location really matters. The second conclusion we had at the time, and I'll move away. You can leave the slide, but I'll move to my other talking points. Well, I'll be speaking to the annex of the guidelines that exactly Teresa introduced. There's an annex there on dealing with slums, and saying, this was a lesson from Monrovia, we really need to have special considerations when we deal with slums. There's something to do with the physical characteristics, but also the social composition of those slums and informal areas. One, very often exactly, they're invisible in the national response because there's a lack of data. They're informal in nature. They tend to not be part of the response when we talk about safety nets. And of course, they're at risk of stigmatization, specifically because they're kind of on the margins of societies as we speak. We also recognize that we have to be very careful not to generalize the different slum communities. One slum community in Monrovia, West Point, in itself, had 9 different sub-communities with different origins, different cultural profiles, different behaviors, different ways of covering themselves in one specific slum alone. It is important to recognize that diversity. Of course, that distrust with governments, being on the margins of society, very quickly translated in the whole range of problems when we're trying to implement measures and act within those settings. Of course, the notes, the guidance very well talks about the consequences of overcrowding, lack of access to services, not just the access under service, but also the fact that a lot of informal services exist, informal pharmacies, informal way of accessing health, which is not easily replaced by more formal health responses as we speak. And of course, the socioeconomic impact is extremely real. The day-to-day survival to access employment and food makes lockdown measures extremely difficult and complicated. And the last point, which is different from camps, that there's no formal management in place. There's not a system in place to manage these areas in a coherent way There is an existence of a lot of community-based organizations, and very diverse, from women groups to garbage pickers. There's a variety of leadership, traditional leaders, youth, women, religious leaders, sometimes competing and fragmented, but there is quite a strong network of organized capacity in communities that has to be taken into account. Now you see that the guidance puts out a couple of key principles. One, it is extremely important to take into account the informal nature that community leaders, communities themselves are able to take a front seat in helping to define how the response can be made operational in a specific slum environment. That buy-in, that leadership role is extremely important. And the importance of also having much more area-based integrated approaches to dealing with slums, combining health measures with economic measures and so on, but being very well aware and take into account the social and cultural norms and the power dynamics within a specific setting. At the time of the Ebola response, and it still continues now also with UNICEF, we've worked very well together exactly with social scientists and anthropologists to help make that connection. Now, there's a number of areas that are further detailed in the guidance notes. I won't talk to every single aspect of it. One, on the data and assessments, yes, we need to invest in profiling early on, in making sure also we're able to connect and integrate the community collected data, because there's a lot of capacity to collect data themselves, which then communities will trust, make it part of kind of broader local government platforms, but also accounting system enough, making sure we have maps, making sure we have a visualization of where this is happening, and having a much more detailed understanding of those specific contexts. On governance, one is that, look, we need to make sure local governments are on board. They do have a capacity to reach out to community leaders. We need to find ways to connect informal governance mechanisms with formal governance mechanisms that giving voice to is relevant for IDPs and refugees, but specifically also for slum communities. I think on communication, again, one thing we have seen that is happening already, it's important to have those feedback mechanisms. What works, what doesn't work, what do people believe in, what don't they believe in? Because again, a lot of the measures don't necessarily won't work because people don't understand, nor do they believe necessarily on the validity of what is being put forward. So that feedback loop is extremely important. On access to basic and survival services in informal settlements, yes, as UNHCR, we are investing everywhere we can in scaling access to water, because of course, it's impossible to wash hands if there's no water to begin with, and that water has to be free. It means exactly we need to work with informal service providers that are normally selling water and making them part of the solution. And one specific note, the challenge also of dealing with of working with children. For them, there's no space in informal settlements. They often exactly gather and try to entertain themselves in very crowded environments. So specific considerations on engaging children in informal settlements is key. Often they're out of school to begin with. On shelter and settlements, we talked about the importance again of mapping opportunities to organize things differently, from mini markets to triage areas to kind of look at potential cases in a safe and contained way. One thing I want to point out, which I think is important from a national perspective, this being able to understand which community connects with which area of origin in rural areas, and being able to connect also community leaders, because if it is an outbreak either in the rural area or the urban area, being able to have preparedness engaged, both talking to leaders on both sides and having that communication and monitoring those movements is going to be very important. So mapping those connections and actively engaging across the country, making those connections will be very, very important. On protection, of course, it's a highly complex environment. There's some concrete experience and guidance, of course, within the Interagency Standing Committee and within the NGO community of dealing with protection issues in these kind of environments. For us, I do think it's important to mobilize the kind of slum upgrading expertise that we have and a lot of others have, kind of development side, and bring it into the COVID response going forward. And again, can't stress enough the importance of engaging with local governments. There is a guidance in the making asked by the principals in December to come up with a framework of engagement between humanitarian actors and local governments. We know that's not often a difficult relationship. There's some draft guidance available and which is embedded in the guidance notes. kind of help you think through on how to articulate that collaboration and make it very concrete and real, take into account the context and the capacities. And I'll end there. Thank you.
Thank you very much, Felipe. I already have a question for you, Teresa and Felipe. So the question is, we do work with IDPs and refugees living in low security environments, low access to water facilities and income generating activities with a high degree of poverty that COVID is obviously exacerbating. Apart from preventive activities and sensitization campaigns, what is from your point of view practically possible in such a context, given that people are reluctant in wearing a mask and won't be even able to wash them for known reasons? Over to you, Teresa and Felipe. Teresa, are you with us?
Yes. So perhaps I can start with the mask, and then I'll hand over to Felipe. I think what is very important to take into consideration is that ability exactly to be able to wear the mask properly, to discard it, throw it away if it's a single-use mask, or to wash it properly if it's a reusable mask. So our recommendation is basically, if these actions cannot be followed, it is better not to wear a mask. Because again, wearing a mask is only one of many prevention measures. Wearing a mask serves as a barrier as much as physical distancing does, and as much as hand washing does, because it prevents the virus to be in contact with our face, with our nose, mouth, and eyes, which are the entry points of the virus into the body. Physical distancing, either through keeping that 1 meter distance or through other approaches, like, for example, setting up physical barriers or arranging movements not to have that direct face-to-face contact, as well as hand washing, are even more important than wearing the mask. So it is extremely important to bear that in mind. Now, it's true that for overcrowded areas where it is difficult to especially respect the physical distancing, then mask may serve a purpose, but it can only be useful and beneficial if it is worn properly. And therefore, our recommendation is, if there is no soap and water to wash hands, there is not going to be soap and water to wash masks. And wearing a dirty mask may even be more dangerous than not wearing a mask. So masks should only be used when the conditions can be met. So that's on the mask for me. Thank you.
Thank you, Teresa. Philippe, please.
Just briefly, I think, of course, in former settlements and slums, IDP communities, refugees are very often mixed with other type of communities. We do think it's important from a socioeconomic perspective to find ways to engage these groups that exist, these organized groups that exist or that need little support, into being part of the response in different ways or shapes, from communication efforts to active production of very basic PPE equipment. But the challenge exactly will be to find ways and locations to do it in a safe, at least in a safe as possible manner. That's why we've suggested exactly as part of the guidance notes to really map out places and areas close by informal settlements and slums that are normally maybe not accessible to these communities, that can be made available for activities of different nature that engage communities, are exactly able to combine livelihood-based activities with the proper awareness raising, as pointed out by Teresa. Over.
Thank you. I have a follow-up question from Messi and then from Damien. Messi?
Say again, yes. Can you hear me?
Yes, please, go ahead.
Okay. I just have to say again, this is one of the conversations that are showing to what extent responding to the challenges that COVID is presenting to all of us requires that we all carry a multi-sector approach. Nothing is happening in a linear fashion. And this is going back to the comment and the question that I will have. I said earlier that the country has made mandatory the wearing of masks. This is a country decision. Second, mentioning that the measures, restrictive measures that were linked to public safety and health, social distancing, have been relaxed. We are the only actors that are in settings where we're providing support to displaced populations, and it just so happen to be they are in high density urban settings. So the risk is even much higher. So we are faced with this, and we need to quickly ensure that as a community, we're finding creative ways to prevent and also to protect at the same time. So the question specifically that I would have, and then I'll have a second one, is how can we make sure as we are engaging, we're able to give the messaging even around all the measures that Teresa, you spoke about, while at the same time explaining that the mask does not do the trick, but it still has to be worn. We still have to make sure that we're organizing the response. Does the mask become part of NFI, and how would we do that? That's another conversation. But for us, it is a very important aspect that we need to take into account. The other question that I would have is, given we need to adopt new reflexes in the planning when we have incoming populations that would have moved, and we recently had a case of floods in areas where IDPs had just been moved, and the agencies had to then, working with local authorities, relocate them. Regarding contingency planning and the reflex of making sure that when we take into account COVID and the isolation and creating the referral spaces, do we have an opportunity, or would there be an occasion where at a cluster level, the clusters are sensitized around the checklist? What are the things they need to look at? Because we also need to adapt to these new reflexes. Over.
Thank you, Mitzi. Teresa, you want to take that? We want to take the first question?
Sure, yes, and I'll also try to address the second one, if that's okay. So thank you. I think it's a very important question, and that's it's an important reality as well around masks. I've also heard these being pushed by governments elsewhere in other countries. So it is true that the decision on obliging people to wear masks at the end of the day comes in the end of the government. I think it is important though that we continue explaining or resharing the messages around masks. There may be room for negotiating as to who should wear the mask as opposed to the entire population. I think it is still within our obligation, and I'm sure that the health partners should absolutely continue working on this. So advocating for the right way to use a mask and the right people to use the mask, that's one side. And on the other side, it is true that in some settings, it is obliged, and people may face fines if they do not comply with what is obliged by the government, in this case, then wearing a mask. So we do see this, though, as an opportunity to also reinforce the other aspects of wearing a mask, because there are two types of masks to choose from. One is the disposable single use, and the other one would be the cloth mask or the non-medical mask that can be washed and reused. If there is no way around if it is impossible to push for the non-wearing of masks, then I think it is extremely important for all of us to make sure that the conditions to wear a mask safely can be promoted. And I think so for the easiest and the cheapest type of mask is of course the cloth mask. And as other colleagues and other panelists have also mentioned, even local communities could be mobilized to then produce their own masks using used fabrics and so on and so forth. But then for the cloth mask to actually be effective and be protective as opposed to be dangerous for the population, then we need to make sure that there is some cleaning is possible. And this is where we could, at the same time, also make sure that people can adhere more to hand washing. So the same material, so the water and the soap that need to be used to hand washing, that need to also be used to clean the mask. It would require more mobilization of communities and more understanding on the risk of not wearing masks properly. I think this would be critical, but then there are ways to also comply with these obligations if there is no other way around it. But then it would be our duty as well as humanitarian actors, as those who are there serving these communities to make sure that the safest environment for wearing a mask is also reached. And as you very clearly said, it is true that it cannot be linear, and it requires the mobilization of all sectors. The wearing the mask, the production or the livelihood activities that are producing a mask, for example, would need to be equally elevated with wash initiatives for hand washing, and to make sure that, and as well as community engagement as well, so that everybody understands how important it is to treat mask properly. I hope this helps. Thank you.
Thank you, Rena. Well, there was another question about preparedness from Mitzi. So maybe Xavier and Jeff, you want to come to address this question? Over to you. Xavier? Xavier, do you hear me? Okay. Xavier, you are on mute. Can you please unmute your mic? Jeff, do you want to say something about the preparedness?
Yeah, can you repeat the question? What was exactly about preparedness which was asked?
It's, you know, the new reality and the new reflexes we should come up with and to adopt with the COVID-19. And that should be reflected in the preparedness.
Yeah, it's similar to the question which we referred to with Metzi. I mean, and I think this is going to be the next wave of guidance notes, which I think the EDG has to consider and work with and send out, is a good understanding of how we start to open up, and that's going to be part of preparedness. We have learned that we had to close. We're learning how drastic this pandemic is. We have good guidance now on camp settings and urban settings, but increasingly it's still an experiment on how we indeed are opening up, and we need to come together and come with good guidance on it. And that would be my main input, is that we are learning, we're putting it together, and the next phase is going to be, I guess, preparedness for how we open up again, because we have to. I mean, if you're looking at the imperative of all the countries who are involved in this phone call, is that the pandemic is one thing, but the economic shutdown is a whole nother. And if we look at food and access and supply chains, and that also means they're opening up. So that's our next phase in guidance.
Okay, thank you, Jeff.
I am back. Sorry.
Go ahead, please, Xavier.
Sorry. Yeah, I wanted to come back to the question of messaging. I think most of the speakers have explained that it's not only an health crisis. It does, it's a protection crisis, it's a shelter crisis, and various speakers mentioned the multi-sectors, inter-sectors work. I think it's very important that our message also speak to the people and to the audience. Let's not forget that in Burkina Faso, the armed conflict, sexual and gender-based violence, and malaria is much more a daily reality than COVID for most of the displaced people so far. So I think it's very important that in our messaging effort, in our communication with community effort, we address all issues impacting the people. If we focus on COVID, when they're suffering attacked by irregular armed group or sexual and gender-based violence, I am not sure our message will go through. So I think it's very important to remember that it's a health, it's a protection, it's a shelter, it's a wash crisis, but the suffering of the people may be different. And in the Sahel, for example, the armed conflict has still much more disastrous production consequences than the COVID for the time being. So I really recommend not to have separate or messages, but to integrate COVID messages in what should be our daily effort. For me, it's we have developed outlines, we have developed different digital concerning work, and we see that we have a huge increase of requests from refugees and displaced, but not about COVID, about sexual and gender-based violence, about recruitment, about attacks, about loss of livelihood. So I think it's important that we really have a comprehensive response and not many different responses. Over to you.
Thank you, Xavier. Well, I have a last question, which is a bit different from all the others. It's really your views on traditional medicine for the COVID-19 treatment. Teresa, you want to take this one?
I can try. Thank you for the question. I think this is also a reality in many parts of the world. I mean, we've seen also early publications of the usage of traditional medicine in China as well at the beginning of the outbreak. As a health agency, I think it is important that our advice remains on proposing or promoting things that have already been proven. It's to be effective, not only to be effective, but also to be safe. I mean, I have colleagues who are better positioned than myself to actually be able to explain our various research agenda, but the Solidarity trial, for example, involved many countries to take part in various clinical trials to test various molecules, known medicines, new ones, as well as other potential molecules or be traditional or more chemically produced or the more traditional pharmaceutical production items being tested. I think what is extremely important here, though, is that there is an unbiased trial research behind before any medicine could be promoted. We have seen even in France, for example, the too early release of data that may not be accurate can mislead a lot of practitioners as well in the way that they treat COVID-19 patients. So it is not that traditional medicine should not be used at all, but I think there's just that big caveat. We need not only to make sure that they're actually effective, that they actually work, there's significant improvement compared to not using that specific medicine for the treatment and the outcome of patients with COVID-19, but also on the safety side, which is a huge preoccupation as well. I mean, we've seen it as well from the trials of hydroxychloroquine, for example, and others, that is also a very big element. Now, so I could, after this webinar as well, share the contact details of my colleagues who are actually leading on the research agenda, so that there could be deeper discussions on where we are vis-a-vis clinical trials for traditional medicines, if they're already there, or how we could initiate one. Over.
Okay, thank you very much, Teresa. Well, thank you. A huge thanks to all the speakers. Now, I am pleased to turn to Rena Jelani, the chair of the Emergency Director Group, for the closing remarks. Rena?
Thank you, Najat. I'm assuming you can hear me, so keep going. Thank you very, very much.
Rena, we don't hear you very well. Sorry.
Right. Let me try again. Can you hear me now, Najat? Can you hear me?
Yes, it's a bit better.
Okay, I apologize. I'm not quite sure what the volume issue is, but if you can hear me, I'll be very brief in that case. Just to thank very much our speakers. Obviously, there is a lot that we don't know, and there's a lot that we do know, and we're focused here on sharing guidance on what we do know, but learning from you, because I think the key here is what we're seeing at the moment is that predictions are not panning out. The modeling is not necessarily showing what is happening. It is not necessarily reflecting what's happening on the ground. Mark did suggest that all of the humanitarian coordinators sit and engage in these guidelines with the country teams to see what would be useful for you in your countries, what's context relevant and what's not. But the important component of this is that because there is so much we don't know, what we would also like is your feedback back up. And Mark is very much himself engaged in trying to support that cross-learning, and these provide an excellent opportunity to share information about the guidelines, but at some point also hear from you what is working, what we're seeing out there, so that you can also share experiences amongst peers. So there are more webinars. Thanks to Najat very much for meeting this demand. And please do send up other topics that you're interested in. We'd really like to facilitate experts who can come engage in a dialogue with you on this. So thank you very much. Please share what you're seeing out there with us as well. That would be the key message I think we'd like to send on from today, and certainly from Mark's perspective, something he'd like to engage with you on. He's embarking on another series of calls with humanitarian coordinators, so this will be an opportunity to actually have that dialogue directly with him. Thank you very much for our speakers today. It was a really interesting session. Thank you very much. Thanks, Najat.
Thank you very much, Rena. Thanks a lot to our speakers for the very concrete examples. I can tell you that we are already receiving very positive feedback and appreciation of all what you have shared with them. I hope to see you virtually in our next webinar next week on 20th of May. The topic will be community engagement and communication strategy at the national and the local level. And until then, please stay safe and healthy.